Welcome, everyone, and thanks for tuning in to this special episode of our Chat with the Dean podcast. Today, we're joined by Dr. Mark Gladwin, Professor and Dean of the University of Maryland School of Medicine and Vice President for Medical Affairs for the University of Maryland, Baltimore. Dr. Gladwin, you are a clinician, an educator, and a leading heart, vascular, and lung physician scientist with special clinical interests and research interests in sickle cell disease, pulmonary hypertension, nitrite, and carbon monoxide. You've made practice-changing discoveries, and you've won numerous academic awards from the National Institutes of Health and the American Thoracic Society. When you think back through the entirety of your career, what would you say you're most proud of?
So for the entirety of my career, I would say I'm the most proud of really partnering with and mentoring really talented young people, and over the course of a career, seeing them succeed. And so, Roberto Machado was a postdoc fellow with me at the NIH, and he's now the division chief of pulmonary at University of Indiana. Shruti Shiva was a postdoc in my lab, and she's now a full professor of pharmacology and with tenure at Pittsburgh. And so it's something you don't think of at the time, but those long-term trajectories of the people that you mentor, that's really special. I'd say from a research and clinical standpoint, I'm very proud of our contributions to sickle cell, really understanding which patients are at highest risk of death and trying to find targeted treatments to bend that curve with those patients. And I'm very proud of our discovery of the nitrite salt as a signaling molecule. That's something that really created a field of research. So those are three things I'm very proud of.
You began your tenure as Dean of the School of Medicine just over a year ago in August 2022. Tell us about your journey to getting here, how you became a physician and all the way up to Dean now.
Well, that's a long story. I'd say the short version is I spent 12 years at the NIH, starting as a fellow in critical care and sort of working my way up. I learned over time that I loved leadership, and part of that love of leadership was kind of filling vacuums or identifying challenges and fixing them. And so within that 13 years, I would move up and tackle bigger leadership opportunities, whether it was research leadership, small scale clinical leadership. And then I moved in 2008 to Pittsburgh to be the director of a newly formed vascular medicine institute. So that was building an institute from scratch, and the division chief of pulmonary, which is a very large clinical and research division. And over time, I was tasked with building cardiology research and then became the chair of medicine. So it was I really don't move very much. I spent 13 years at the National Institutes of Health, 13 years at Pittsburgh, but every 3 to 4 years, I take on bigger leadership projects. And I think that's what positioned me to be able to take on this job. And I look forward to another 13 to 20 years here.
And then what?
That's that. Maybe by then I'll be exhausted. Right. We'll see.
So who or what inspires you most? What keeps you going?
So I think I'm the most inspired by really bright, passionate people who are really committed to sort of bending the curve of health or science outcomes. People that want to make an impact, a positive impact. And so, but I think it requires people that not only have that passion and that vision, but they can, what I call, operationalize that objective, that that through resilience, grit, organization, commitment, dedication, can see that through. So people like that really inspire me.
Tell us what it takes to become a great academic leader.
So maybe I'll comment about leadership in general. I think there's probably not a lot of difference between being an academic leader or CEO of a corporation or a politician. I think they're really all the same. I mean, I think the number one is you have to love leadership, because you can't really control your schedule, and that work will, cross personal lines and time. And so you have to love leadership. And I think the other piece is when you decide to take on leadership, you have to make a decision that you're going to spend most of your time solving other people's problems or advancing an agenda beyond yourself. And so a lot of times young people are interested in a leadership title or a leadership opportunity because it's the next thing above them. And I think it's important just to remember that you really have to have a passion for it, and that's, ambition, a desire to make an impact, and that you have to be willing to sacrifice to achieve those goals. And it has to be about the mission, the people, the impact. What I personally, I've always loved leadership. I was the captain of my soccer team and student government and just whatever it was. I would always take on leadership. And one of the keys to successful leadership, I always tell people, is do the job that you want or fill vacuums. There's so many problems and challenges around us, opportunities, and you don't need the title to fill that vacuum and tackle that responsibility. And often throughout my career, I would find that I was sort of doing that next step of the job above me. And so, for example, as the head of pulmonary and the head of vascular institute, I took on building cardiology research, and so took on a major role in leading cardiology. But I'd really started that through the vascular institute, really independent of having any sort of title in the cardiology service line. But overall, what I really love about leadership is the ability to just have a bigger impact. That I love change. I love solving problems. I love the opportunity. For example, here we have the opportunity as faculty physicians in West Baltimore to try to bend the curve of early kidney disease among African Americans, mother-baby outcomes. This region has an F grade for bad outcomes for mothers and babies. That's an enormous challenge and opportunity for us. We face opportunities to tackle addiction, depression and mental health issues, violence, pandemics, the obesity epidemic, the aging of our population, the explosion of technology and big data. These are all enormous generational challenges and opportunities. And as a dean or as a chair or as a leader in a great academic medical center, we have the opportunity to tackle those transformative challenges.
So all of the people that you've mentored over your career, is there one piece of best advice that you give each of them?
Well, I have to say that over the later phases of my career, I've begun to really like mentoring leaders. So as a chair of medicine at Pittsburgh, I had 10 divisions and 2 institutes. And so even with some of those leaders maybe being older than me, or in many ways that might be their largest leadership position. So they may have been, incredible scientists or incredible clinicians, or have tackled, major center-based leadership, for example, but that's the first time when they're leading across the tripartite mission. So I really enjoy mentoring leaders. And, there's a number of things that I talk to them about. One obviously is you have to have an organized strategic plan. Otherwise, you're only reacting to crises. So in any given week, in any given day, there will be HR issues, financial issues, budgeting deadlines. There's crises that hit. But to be an effective leader, you have to map strategic plans. So every day you're advancing a strategy as well as reacting to and addressing challenge. The other thing I tell leaders is, you start to schedule. You can carve out personal time for your own research programs or your own clinical, but that's going to be a small piece of what you do. So you have to schedule that so that you have that time to really dedicate to, again, addressing your leadership job and solving other people's problems. And then I think, over communication is a huge part of leadership. I think people don't quite appreciate that. And I always say you have to understand operations and budgeting, because there's no margin, no mission. So those are some of the things that often people need the most help with. I think managing people and managing talent is probably the most challenging part of leadership. But most people that get to that level have a high EIQ. They have great interpersonal skills. They have that ability to judge people and what motivates them and how to modify behavior or incentivize great behaviors.
How do you personally prevent burnout for yourself, for your team, and for others that count on you?
Yeah, that's a great question. And I should have mentioned that because this is something I really counsel all faculty and students and leaders, that you have to invest in yourself, your own resilience, your own grit. And that investment is all the things your mother would tell you to do, sleep, eat well, exercise, take time to read or do things that have nothing to do with your work, and invest in your friends and your relationships. And that investment is making sure you spend time with your kids, making time you spend time with your partner, making sure you really invest in those friendships, because that's what makes you strong, resilient, and you're much more capable of doing a great job as a leader. So I do all those things. In fact, I'll share with many of my chairs and the division chiefs or leaders that in the same way I approach a strategic plan for work, I'll actually approach a strategic plan for my personal life. And it's sort of like resolutions on steroids. But so that I think about it, when my children were young, it's okay, what am I doing with each kid? What are the fun things we're going to do together each year? And, for example, I would always take one of my kids with me to a meeting at least every other year, one-on-one. I had 3 kids.
I'm sure they loved that.
Oh, yeah.
Fun,
Yeah,
right?
yeah. The boys always wanted to go to Orlando and Disney World, whatever. There's always conferences in Orlando. Mm-hmm. My daughter was much smarter than them. She always wanted to go to Paris or Italy or Spain.
Right. You girls usually are.
Yeah. Yeah.
That's great. So tell us about your vision for the School of Medicine and what we can expect over the next few years. What advancements are coming to the school?
Yeah. So this is an incredible place. I mean, we are, if you think about it, we're in an incredibly rich ecosystem of academic medicine. We have Georgetown, Inova Fairfax, GW, Howard University, NIH, ARPA, DARPA, HHS, NIST, Hopkins. The list goes on and on and on. And we're the major public university in that rich ecosystem. So that's a special place. About 43% of our medical students this year are in-state, and about 20% of physicians in the entire state of Maryland trained here. So we have this, and we have partnerships with all those institutions that I mentioned. So I think we have a really unique, rarefied role in this region. And so I'm really excited about the impact we're going to make serving our communities, our signature role in shock trauma, our role as leaders in cardiac surgery and transplantation, our roles in innovation and science are remarkable. We have institutes that are addressing pandemics through the Center for Vaccine Discovery and the Institute for Human Virology. I could go on and on with the list, and which I will on Wednesday for our State of the School. But I'm really excited about another thing, and that is, and relates to the faculty practice, that many faculty practices have been subsumed by a corporate healthcare system. So if you look at Mayo Clinic, Cleveland Clinic, or even where I was, the University of Pittsburgh Medical Center, the faculty practice is part of a larger non-for-profit corporation. And that has advantages in terms of the efficiency of care. But I think it's resulting over time in physician burnout and really a sense of being lost and disengaged in the process or the primary bedside care of our patients. And so what's really nice here is we have physician-run faculty practice. And that's one thing that really made me excited about coming here, that we have a powerful partnership with the medical center and the medical system. And we want to grow that alignment, that synergy, that partnership. But we still have value-driven physician-run practices. And I think that keeps us close to our values. which is, of course, is excellent patient care, commitment to our communities, and it keeps us close to our academic commitments that we are a lot about teaching the next generation and about advancing science to improve patient outcomes.
Speaking of advancing science, you touched a bit on vaccine discovery and, some other research interests that we're currently involved in. Can you talk about other exciting clinical research currently underway and in what areas you'd like to expand?
Yeah, so great question. Again, I could talk for hours about this, but I'm one thing I like to do, and I'll talk about this at the state of the school, is to think about our central role in addressing great generational challenges that face all of our citizens, not just in Maryland, but across the country and in the world. And I think we're uniquely positioned to address many of those challenges. So one, for example, is just the disruption and the opportunity, but the challenge of information technology, AI, machine learning, electronic healthcare record, population health, big data, precision medicine, multi-omics. I mean, it's overwhelming challenge and opportunity. And so through the creation of the Institute for Health Computing, which is a $68 million investment in health computing, a partnership between College Park and the University of Maryland in Baltimore, we're going to be really taking advantage of the electronic healthcare record information from 2 million unique people that are in the system and trying to reach out through the EHR and improve patient care outcomes. Identify risk of overdose and risk of substance use disorder, identify early kidney disease, again, address mother-baby health. So that's a huge opportunity. We are leaders in the area of pandemic preparedness. We're one of the few centers in the nation that actually will give someone a vaccine, a normal volunteer, and then infect them with influenza or malaria. We actually have live mosquitoes in our research labs, and we let them bite volunteers. And of course, we monitor them every day, and as soon as they develop infection, we treat it. But we're testing whether those vaccines work. And this is a way to rapidly accelerate vaccine efficacy studies. So if we ever have another SARS-CoV-2 that's more lethal or maybe kills children at a higher rate, we could activate these kind of trials. So that kind of exciting work we do here is unique. We're also another area that we're very well positioned for and that represents a generational challenge is addiction. All of us are affected. Baltimore is now the number one city in America for overdose deaths per capita, number one. And Maryland is number one state, despite our wealth, for overdose deaths per capita. And this year we hit a record 100,000 overdose deaths across the U.S. And the risk of substance use disorder and overdose is rising exponentially. So our children, our family members,
What do you credit to that?
It's interesting. There was a really interesting study that just looked at all drug use, whether it's methamphetamine, OxyContin, oxycodone, heroin, and now fentanyl and sufentanil, but any type of drug. And there are waves in different communities, in different populations. The crack cocaine wave occurred in urban Black communities. The oxycodone, OxyContin wave occurred in elderly Caucasian grandparents in the Midwest. But if you look at across the whole state, a whole country over time, the sad story is that the number of people that are addicted is rising exponentially. And if you follow that curve, it's possible that everybody could become addicted at some point, depending on the economics and market forces that are exposing us and our children to these drugs. So we have to really understand the human brain itself. How can we prevent that? How do we bend that curve? If you do get addicted to heroin or fentanyl as a young person, or even nicotine and vaping, high nicotine content vaping, if you do that at age 17, it's hard to turn that off. So we're going to need to just understand neuroscience to try to turn that addiction off and save lives. So we have a new addiction research institute, which we've launched, called the Collard Institute for Addiction Medicine. And right here on this campus, we have more than $40 million a year in addiction grants already. but we're going to make big investments to try to expand that work.
What makes the University of Maryland unique? I mean, you've touched on a lot of our advancements, the fact that we've got great academic medicine and that we are the leading public institution in the region. But why should physicians refer to us? Why should med students consider us? Why should patients come to us? What makes us overall superior and unique?
Right. Well, first of all, American public universities have an incredible brand, whether it's the University of California, San Francisco, or the University of Michigan, the University of North Carolina. We have incredible brands, and our Maryland reputation and brand, this knowledge or this appreciation of excellence is very strong. We're now in research, number 9 in the nation for research funding among great public universities. So we aspire to be considered at the same level of the University of California, great academic medical centers, University of Michigan, UNC. But so that's one piece of it that I think we are, and that brand across the board, that history attracts talent. So I've been impressed in my year here that people want to work here and want to be here. And I know in FPI we've got great employee satisfaction scores. So people really want to be here. And so that's one thing. So that results in really the best medical students, the best residents, the best fellows. And we have areas of excellence that, like critical care. I've just been amazed working in the ICU at how great our critical care fellows are. We have emergency ER, internal medicine critical care. We have interesting mixes, anesthesia critical care. So I think we really attract, very talented trainees. And then a lot of those people stay. They're staying. About 20% of our residents come from our medical school, and they stay for fellowships, and they serve as faculty or come back. I think we also have a reputation of excellent clinicians. There's a real commitment here to education and clinical excellence. Some places may excel at research, but maybe they've lost that commitment to bedside teaching, that commitment to bedside clinical excellence, the knowledge of medicine, that commitment to communicating with patients. So I think that's something special about us as well.
So you mentioned great clinicians here. You yourself are a clinician as well. Tell us about your patient care philosophy.
Well, I'd say now it's fair to say that I dabble. I'm not quite the clinician that our faculty are in any given day. I trust them with my life and ask for their help when I'm on service. But I love patient care. I've always loved it, and I've always done critical care. And during COVID, because of the need, I spent a lot more time. So I sort of shifted back towards clinical operations and personal clinical work. So I did hospitalist services and a lot of ICU time during COVID. So I feel at least it's brushed up my skill set.
Right.
But I've always loved critical care. And so, I think I personally believe that it's very important, especially as you get older as a physician, to constant invest in the knowledge of medicine. So I do read and study. I wrote a textbook in critical care that keeps me up to date, but pushing yourself to constantly reinvent yourself clinically. For example, one of the disruptive technologies in medicine is point of care ultrasound. When I trained, only cardiologists or OB, sonographers would do ultrasound. But now the technology is at the point that you can connect an ultrasound to your smartphone. So I had to learn point of care ultrasound for critical care. So I went with the fellows and retook classes. So I think it's important to reinvest in that knowledge. The other thing as I get older, I appreciate more than ever is how, communication with patients. People are, especially in critical care, in surgery, with cancer, there's so many, patients are vulnerable. And it's probably one of the most vulnerable points of a person's life is if their loved one's sick or they're sick. And so you can't there's no such thing as over communication. We have to make sure we're spending that time. And also as teachers, we're role models. And whether we appreciate it or not, everyone's watching you. And the students are modeling your behavior. So that how you project, and I tell this to the medical students, residents, and fellows, even at the earliest point of their career, they are leaders and role models, and people are studying how they behave. And so they create the values and the energy of the academic medical center. So we have that responsibility as well. So in my practice, I'm purposeful and thoughtful about, or deliberate, I'd say, about those three things.
Dean Gladwin, before we close out, is there anything else you think listeners should know, or any messages that you would like to send to them?
I think that this is an incredible institution, and I've been so impressed with the research. I did 47 mini retreats in my first 3 or 4 months here, and so I really had an opportunity to see all our departments and meet the investigators. So the science is at an elite level, and having been in the clinic, the clinical care and the technology at the bedside here is state of the art. And so I've noticed that this is a very humble institution, which is wonderful. But I've been encouraging people to be a little more, I won't say cocky or
Right.
braggy, but you're in media, so you can brag for us.
Right.
And part of my job is to brag for the faculty. So I'm incredibly proud of the faculty and our investigators. And the entire, the educators here are elite. So it's just an incredible organization.
Great. That's all the time we have today. Thank you for joining us.
Thank you so much.
Gladwin.
Yeah.
It was great getting to know you more, and I'm sure our listeners will enjoy this episode as well.
Likewise.
So thanks for taking the time.
Thanks for doing this. This is an important thing you're doing. Thank you.
Yeah.
Thanks again for stopping by for Chat with a Chair, brought to you by University of Maryland Faculty Physicians, Inc. For more information about today's guest or to listen to additional episodes, visit umfpi.org/podcast. Until next time.